Here's another great video. Dr. Morad Shaglouf. This is retraction cord removal after composite restoration. So starting off this video, before we play it here, we can see that there is a dark line around this person's tooth, and a bunch of these teeth are super broken down, meaning they've got chunks missing and all sorts of stuff. So this is kind of a crazy looking view. I always joke whenever my wife looks at teeth stuff, she just says, gross. And so she's right. And I'm a weird dentist, so I think this stuff is interesting. But that being said, we can see there's this dark line around this tooth here, and this video is going to show us what the heck it is. And as a dentist, we use this stuff all the time. It looks super crazy, like what the heck are they doing and pulling out around this tooth? But like, what is that? And so what they're doing actually is using something called retraction cord. This is really common in dentistry, and what it is it's actually just a little braided like piece of string is all it is, that's specially made for gums, and it goes in and it helps to push the gums just gently out of the way so that we can put fillings or take molds or do things without hurting the gums. It's just a way to massage them out of the way gently, and we do that with this retraction cord. Looks super gross and weird, but it's actually used just to help protect the gums or to make impressions better or help us with fillings so that we're not hitting the gums, and also to keep them out of the way because a lot of dental materials have to work in a dry environment, and your gums actually naturally produce saliva. And so if we can put that cord in there, it helps to soak up some of the moisture and prevents that from contaminating the filling that we might be doing, which is probably the case here for this video. But isn't that super wild looking at that coming out of the gums? Those are crazy. And we get those questions all the time from patients, but we use it so commonly that we just think of it as normal at this point, which is weird on us.